Hi everyone, I am the nurse Dr. Asia. If you are struggling with pediatric dosage calculations, this is the video for you. So go ahead and like and share it with all your classmates so you all can make 100 with your pediatric dosage. Our first problem. So the problem says that the recommended dosage is 6 mg per kg a day in 3 divided dosages. It says that the child weighs 7 kgs. You have 6 mg per 2 mLs available. How many mLs will the child receive each day? So first you want to start off asking yourself, what unit of measure should I end in? So the question is saying how many mLs would the child receive? So we know that we need to be in mLs basically per day. So I'm going to go ahead and write that on the side. All right, so I like to start with the recommended dosage. So I'll do 6 mg over kg per day. Now I am able to do dimensional analysis and cross out the things that I don't need. So my answer needs to be in mLs. So that lets me know that mgs has to go. So the problem says that there is 6 mg per 2 mLs. So 6 mg is going to go on the bottom. Why? Because in order to cross out, it needs to be on the top and it needs to be on the bottom. And then we'll end up with 2 mLs. All right, so we are now left with mLs, kg, and day. But we just need to be left with mLs per day. So we got to get rid of our kgs. So it says that the patient weighs 7 kgs, and we're going to put that just over 1. And we know that kgs has to go on the top because kgs is on the bottom right here. So it's just going to cross out, and then you're going to multiply straight across and then divide, and then you should get 14 mLs per day. And that's your answer. As the recommended dosage is 6 mg per kg a day in 2 divided doses. The child weighs 5 kgs and available you have 5 mg per 2 mLs. How many mLs would the child receive each dose? So we want to write down what we need. So the question is asking for mLs each dose. So we're going to put ml and each dose over here. All right, so again, I'm going to start with the recommended dosage, which is 6 mgs over kg a day. So now we're going to just work it through on getting to mLs. So we know that mgs has to cancel out. So there is 5 mgs in 2 mLs. So mgs cancel out, mgs cancel out. The child weighs 5 kgs. You put that over 1. So kgs then cancel out. And then we're left with mLs per day. So we're going to multiply straight across. And then we're going to divide. So we should get 12 mLs per day. But the question is not asking for mLs per day. It's asking for mLs per dose. So we want to go back to the problem, and it says that the child receives this in 2 divided dosages. So we're going to divide 12 by 2, and we're going to get 6 mLs per dose. So it's very important that you pay attention to what your question is asking for. This question is asking for the dose, not the day. Recommended dosage is 3 mg per kg a day in 2 divided doses. The child weighs 19 kgs. You have 6 mgs per 2 mLs available. How many mLs would the child receive each dose? So we want to write down first what the question is asking for. So the question is asking for mLs per dose. So again, we're going to start with the recommended. So the recommended is 3 mgs per kg a day. All right, so now we're going to go back to our problem. Our problem says that there is 6 mgs per 2 mLs. So we're going to put mgs on the bottom because we need that to cancel out. So then mgs cancel out, and we're left with mLs, kg, and day, which we don't need kgs. So the patient weighs 19 kgs. So kgs then cancel out. And then we're going to be left with mLs per day. All right, so once we do that, we're going to get a total of 19 mLs per day. But the question is not asking for mLs per day. The question is asking for mLs per dose. So it says that in the question is divided into 2 doses. So we're going to divide by 2. So we should get 9.5 mLs per dose. Recommended dosage is 2 mgs per kg a day in 2 divided doses. The recommended single dose for a child who weighs 25 mgs would be how many mgs? So this question is a little different. So this one is asking what would the single dose be for a child? So we want to calculate the mgs. All right, so we know our answer needs to be in mgs. So again, I'm going to start with the recommended dose. So the recommended dose is 2 mgs per kg a day. All right. So we want to be left with mgs per basically dose. So let's go ahead and get kgs cancel out. So it says that the child weighs 25 kgs. Put that over 1. So we're left with mgs per day. So we're going to do 2 times 25, and then we'll get 50. So we'll get 50 mgs per day. But what is the question asking for? The question is asking what is the single recommended dose. So we go back to the problem and we see that this dose is divided into 2 doses. So we will take this 50 and we would just divide that by 2, and we would get 25 mg per dose. So you want to make sure that you're reading your problem to figure out, is it asking for day or is it asking for dose?